Welcome to the Pregnancy Help News Brief. I'm Lisa Bourne, Managing Editor of Pregnancy Help News. Here is a look at this month's top stories. Pregnancy Help News published a compilation of pro-life response in the immediate aftermath of the tragic shooting death of Charlie Kirk. Abortion is found once again to increase the likelihood of mental health difficulties. The dangers of chemical abortion are continually at the forefront of the news as pro-abortion politicians persist in pushing for unfettered access to the controversial drugs. Cases emerge of women being unwillingly drugged with the pills, and federal officials admit that the previous presidential administration twisted data to downplay the dangers of the drugs. Pregnancy help is being mimicked by abortion proponents, with so-called pro-choice pregnancy centers beginning to pop up. But can they truly replicate the mission? Now let's take a closer look at our top stories. A new study of over 1.2 million pregnancy outcomes in Quebec, Canada, confirms that psychiatric hospitalization is over twice as likely to occur after induced abortions than after live births. The rates of hospitalization were especially higher for substance abuse disorders and suicide attempts. The study, titled Induced Abortion and Implications for Long-Term Mental Health, a cohort study of 1.2 million pregnancies, was published in July on the National Institute of Health National Library of Medicine website and confirms the trend in a series of recent record-based studies linking abortion to elevated rates of mental health disorders after controlling for prior mental health. The Biden administration misrepresented data on chemical abortion pill mifepristone to obscure safety issues with the drug. Health and Human Services Secretary Robert F. Kennedy Jr. testified before the Senate Finance Committee September 4th. Oklahoma Senator James Lankford asked Secretary Kennedy about ongoing FDA review of safety protocols for mifepristone. Kennedy confirmed that a review was progressing and said that in the process it was determined that the Biden administration had, quote, twisted, end quote, the data on mifepristone's safety. Secretary Kennedy said, "We're getting data all the time, new data that we're reviewing, and we know that during the Biden administration they actually twisted the data to bury one of the safety signals with a very high safety signal of around 11%. So we're going to make sure that that doesn't happen anymore. We're producing honest science and gold standard science on that." FDA review of mifepristone is hotly contested, with pro-life advocates hoping the federal agency will reinstate the drug's safety standards and otherwise act to protect women, while abortion proponents claim mifepristone is as safe as Tylenol and argue that safety regulations for the drug impede abortion access. A groundbreaking analysis released in April of 865,000 insurance claims of women who were prescribed mifepristone abortions from 2017 to 2023 found that mifepristone is 22 times more dangerous than previously recognized in FDA data. The report by the conservative think tank Ethics and Public Policy Center said that nearly 11% of women experience sepsis, infection, hemorrhaging, or another serious adverse event within 45 days of taking the drug. Heartbeat International President Jarrell Godsey said it is no surprise to learn about the intentionally twisted data in the prior administration. The bigger question, Godsey said, is once finding it, will this administration have the courage to correct the analysis and act to protect the public? Priests for Life's Janet Morana brought us the story of how, on the same day that pro-abortion Illinois Governor Jay Pritzker was signing a new law mandating that public colleges and universities make the abortion drug mifepristone available to students, an Illinois man allegedly admitted to police that he had drugged his girlfriend with mifepristone to end the life of their unborn child. Emerson Evans was charged with 2 counts of intentional homicide of an unborn child after his child was expelled from his or her mother's womb, and the mother was sent to the hospital following the mother's unknowingly ingesting the drug. This is one of several cases surfacing of late with partners of pregnant women slipping them abortion drugs without the woman's knowledge or consent. These scenarios highlight one of the dangers of unregulated access to chemical abortion drugs online. Marana explained that as access to abortion drugs continues to expand, the more likely we are to continue hearing these tragic tales of women losing their children because the baby's fathers have other plans. She also told readers that abortion is not health care, and no one deserves to suffer an abortion against her will. Continuing on the dangers of chemical abortion pills, the Daily Caller's Caitlin Richardson wrote about the current varying cases of readily available mail-order abortion drugs reportedly used to trick women into ending the lives of their unborn children and the accompanying concerns about forced abortions. She detailed how Texas Attorney General Ken Paxton sent cease and desist letters on August 20th to 3 entities shipping abortion drugs into the state. She also noted that of more than 200 women who reported abortions in a 2023 survey by the Charlotte Lozier Institute, 1 in 4 women described their abortions as, quote, unwanted or coerced, end quote. Maria Rojas, who ran an underground abortion clinic in the Houston area, was arrested in March and is now charged with 15 felonies, 12 for practicing medicine without a license and 3 for performing illegal abortions. Rojas operated 3 facilities in Houston for years. She allegedly deceived women into thinking she was a licensed physician, when in reality, she only had a midwife's license. Reports say she handed out abortion pills as though she were a doctor, and even went to New Mexico to perform an illegal abortion. Rojas has denied everything, but a grand jury found her guilty on all 15 charges in June, the files only recently released to the public. She is also appealing to the Texas Supreme Court to try to reopen her closed clinics. Abortion proponents who so frequently label pregnancy help centers as so-called fake clinics are now launching so-called pro-choice pregnancy centers. Heartbeat International Vice President of Communications and Marketing Andrea Trudden wrote about how the hypocrisy here is stark. For years, abortion-supporting critics of pregnancy help accuse life-affirming centers of deception, even vilifying them as fake. Now, some of those same critics are copying the model, cloaking pro-abortion rhetoric in life-affirming messaging. This is more than rhetorical gymnastics, Trudden said. It is a strategic blurring of the lines. She shared statistics of the scope and reach of pregnancy help in the U.S., as well as the many services provided and the client impact, before then detailing the magnitude of volunteer and staff support in pregnancy help organizations. The pregnancy help figures reveal a simple truth, Trudden said, and that is that the pregnancy help model works. It is so compelling that opposing ideologies feel compelled to emulate it under a different brand. But this imitation is carrying the risk of confusion and potential diversion of resources, underscoring the need for clarity in message and mission for pregnancy help. Pregnancy help organizations should respond to any emergence of such, quote, pro-choice pregnancy centers, end quote, by showing the real impact of their work through sharing of concrete stats. They should also stand on ethical excellence as laid out in the commitment of care and competence. And they should share the stories of women whose lives were changed, families supported, and babies welcomed through their work. Let the so-called pro-choice pregnancy centers imitate, Trudden said. True pregnancy help organizations will outshine, outcare, and outlast them with truth, love, and evidence. Pregnancy Help News published a roundup of reaction from pro-life and pregnancy help advocates to the tragic shooting death of conservative activist, author, and Turning Point USA founder and executive director Charlie Kirk. Kirk was murdered by an assassin September 10th while appearing at Utah Valley University for the kickoff of his organization's The American Comeback Tour. He is remembered for rising to prominence at a young age as a passionate activist whose organization educates, trains, and organizes thousands of young people to advocate for traditional American values. Kirk was considered controversial by many who were opposed to his ideas. He is survived by his wife and their 2 young children. Reactions were immediate following the September 10th killing of Kirk, who worked tirelessly to engage in good faith debate on cultural issues, including life, faith, and freedom. He is known for maintaining respectful dialogue, often in the face of vitriol. The pro-life responses to his murder continued to flow the following day, and overall they ran the gamut of profound grief and shock, with appeals to faith and calls to continued action for freedom of speech advocacy, along with memorializing Kirk's legacy. Heartbeat International published a social media graphic containing a quote from Kirk. It said, "If you believe in something, you need to have the courage to fight for those ideas, not run away from them or try to silence them." Charlie Kirk was 31. That's the news for this episode of the Pregnancy Help News Brief. All of these stories and more are available to you 24/7 at pregnancyhelpnews.com. Thank you for joining us for this episode of the Pregnancy Help News Brief on the Pregnancy Help Podcast. I'm Lisa Bourne. Subscribe to receive updates on future episodes.